Hello and welcome to our live Q&A, your questions about the 2022 HTAi annual meeting, Lifecycle Approach Theme Answered. Throughout the webinar, a link to Slido will be pasted in the chat. If you would like to submit a question, please click that link and submit them there. Using that link, you also have the ability to vote for others' questions you see appearing there instead. Please do not use YouTube chat to submit your questions. Thank you again for joining us. I will now hand over to Anne Single to introduce today's webinar.
Thanks, Bryce, and welcome everyone to our first live Q&A chat. For those who don't know me, my name's Anne Single. I'm the chair of the Patient and Citizens Involvement Interest Group, and I'm with Patient Voice Initiative in Australia, and I'm one of the co-chairs of the International Scientific Program Committee. And with me today, I have Professor Dr. Jan van der Wilt, who is the head of the HTAi unit at Radboud University Medical Center in the Netherlands. And we have our other co-chair, Dr. Wim Gosch, who is a special advisor in HTAi at the Zorg Institute, or you might call it ZINO, in the Netherlands. And he's also with Utrecht University. Welcome both.
Welcome.
So today is a really informal session, and it's just with the aim of gaining a better understanding of the theme for HTAi 2022 in Utrecht, especially as we're all working to develop our abstracts at the moment. So I'm going to ask my co-panelists a few questions, and we'd love to receive your questions. So Wim, my first question's for you. It feels like we've only just logged off from HTAi 2021. So are our panel and workshop abstracts really due this month?
Yes, thank you, Anne, for the introduction. I think, firstly, we have to acknowledge that the virtual meeting of HTAi 2021 was, I think, an enormous success. I've been involved in numerous sessions, and I was really impressed by the level of commitment of all the people which participating. And I saw also there was a lot of interaction. So we really need to actually continue that commitment and involvement of the HTAi members and others which were there in the meeting in 2022. And I think that we need to do actually, we have to take additional efforts to sustain that involvement in 2022. And you probably are aware that due to all the things that happened with COVID, and now the idea that we need to have, again, a face-to-face meeting in Utrecht in the Netherlands, which was different from what originally planned, the timelines are short. And the conference is already in here, I think, in approximately 9 months. So June 25 until June 29, 2022. So we really need that amplified, intensified, and timely involvement of the whole HTAi community in this conference. Therefore, it's crucial that we have this early abstract submissions, firstly for the panel and workshops, for which we have the deadline on October 26th. And then, of course, also the deadline for the oral and posters in the beginning of December. I think it's, again, also here, I hope that a lot of people participate, are very willing to actually submit these panels, submissions, workshop submission, because that will really make the conference to a big success. And then I also think that finally, also relating back to the theme of the 2021 meeting, that the life cycle approach fits very well to the theme, which was actually the theme in 2021, which was innovation through HTAi. So I think there is a kind of natural connection, which makes it also, I think, very interesting for people to just move on from the conference virtual to the next conference in 2022 live in Utrecht.
Thanks, Wim. I guess I was so surprised that a virtual meeting could be as engaging as HTAi 2021 was. So congratulations to all that team. And I'm interested in this life cycle approach theme. But Jan, could you tell us a little bit more about it? What exactly do you mean by it?
Yeah, thank you. So I think it's fair to say that traditionally HTAi has been conceived as a sort of one-off activity, where the focus is on the retrieval, the critical appraisal, and the synthesis of evidence to support coverage decisions. So at the time when we think we want to make this decision, is this technology, so to speak, good enough, of sufficient value in order to be incorporated in some sort of general or collectively funded scheme? So reimbursement issues. It always was the question of the timing. So the timing was crucial. And I'm sure many people know this idea of it's always too early until very suddenly it's too late. And the idea was it's always too early because a technology needs time in order to sort of evolve and materialize and establish its true or potential value. And it can be at a certain time too late, because then there is perhaps a general feeling within the field that, okay, now it seems to have sort of proven its value, and now it's no longer an issue whether it should be reimbursed, yes or no. And this life cycle approach takes, I think, a slightly different perspective on this. And it tries to acknowledge that health technologies evolve over time. So it raises questions like, how and where and when do those technologies emerge, so to speak? Where do they come from? How do they evolve over time? And that may be very, very sort of fundamental changes, meaning that technologies may actually become more valuable over time, more or valuable to a wider group of patients. But it may also mean that they lose some value because of concurrent technological developments, developments in patterns of disease, et cetera, et cetera. So an example could be, for instance, what I found fascinating is the LVAD, the left ventricular assist device. Originally, it was seen as a bridge to transplant. So we saw that people who were on the waiting list in order to get a solid organ transplantation, because of long waiting lists, some of those patients very regrettably died before they could have this transplant. And so the idea was, can we somehow prevent that from happening and try to rescue them and support them using those LVADs? So that was done. Then surprisingly, what was seen was that in some of those cases, at least, the LVADs seemed to be much more sort of destination therapy. The patients sort of partly recovered, improved, and might not need, in fact, this solid organ transplantation. So there you see that a technology may evolve originally from the heart-lung machine to an LVAD, to bridge transplantation, to recovery and a destination therapy. And so this is, I think, very, very common. And so we have to acknowledge this. And I think this calls for a more careful monitoring of how health technologies evolve, and raising the question, okay, so what would be appropriate sort of moments in time in order to look more carefully at those technologies and see what is their value, under what conditions and for whom. And that may be very different at a very early stage as compared to a more mature and a later stage of development. So I think that is generally the idea underlying this life cycle approach.
Oh, that's a really interesting example you've given, and it reminds us, and perhaps to people who are new to the field of HTAi, that not only is it about determining value, but it's thinking about consequences, both intended and unintended. And Wim, what was the thinking behind choosing a life cycle approach as the theme, and what are the expectations around a transition to a life cycle approach?
Yeah, I think building on what Gert-Jan was saying, I think I come from an HTA agency, and historically we have been much focused on this one-off assessment. And now we see that we have a more general approach where next to that still activity still going on, there's much more focus on actually ensuring quality of healthcare. And then subsequently also thinking, what can we do as an organization to actually support appropriate use of these technologies which come to the market? So in that sense, I think there is a common perspective that introduction is only a very small part of the whole chain of what is happening. And therefore, we should also put much more efforts in actually focusing on appropriate use. And also because technology is much more become what we call dynamic. For an example, we have been involved in a lot of work on new cancer therapies. And new cancer therapies come to the market most of the time only for a very small indication. And then subsequently there is use in practice, and then you see widening of the indication. More and more patients are going to use it. But at the end there might be also a shift to certain indications. So I think as an HTA organization, you want to actually follow this. So there will be much more focus on actually looking at what happened in clinical practice than on this first assessment, because we think it's conditional, because the treatment will go to change. Different patients are going to use it in different settings. So just from that perspective, I think for an HTA agency, this change is very natural. But of course, people have been educated to really focus on this one-time assessment, and making the change also means that we have to change our way of working. And therefore, this life cycle approach in this discussion is, I think, very timely in what we're currently doing.
What you're talking about is really, a huge transformation of the way we understand health technology assessment and its space in the health system. Are there examples of people who are already doing this sort of work? Gert-Jan, do you have any examples?
I agree completely with you that this is going to be a huge transition. And actually, I think that the answer to your question, this is actually, in my view, one of the things that we really want to find out during the conference. We would like to attract as many people as possible from around the globe to attend a meeting and to share their experiences and to reflect and discuss with us on this proposed transition of HTAi. I think that there are a number of agencies across the globe who are currently sort of experimenting with this approach, trying to incorporate, so to speak, early HTAi in their activities. And of course, there has already been considerable interest also in disinvestment. So when we think technologies have become sort of obsolete, how do you manage this? How can you achieve that there is sufficient agreement on this and that people stop using this, or stop using it for wrong indications, which very much refers to what Wim was saying, the appropriate use. My understanding is that CADAS in Canada is one of the agencies that is currently already some agency, but also I think the National Healthcare Institute in
Gert-Jan,
I have served at the National Appraisal Committee, which is both.
We're just having a bit of trouble with your, sorry, Gert-Jan, sorry to interrupt you. We're just having a bit of trouble with your signal, but now you're back again, so I apologize for interrupting. If it keeps going, we might try the trick of turning off the video, but hopefully we won't have to do that.
Okay, so thank you, sorry for that. So the National Healthcare Institute in the Netherlands has been experimenting with this. appropriate use is a tremendously important issue currently, and we have been experimenting with also scoping, and scoping means that you try to involve various stakeholders at the start of the HTAi, trying to bring different perspectives to the issue and see how they look at it from their perspective when technology is still in its infancy, so to speak. Where we have to discover perhaps so what might be the most appropriate use and when it develops further. So, but again, I think one of the for me very exciting sort of outcomes of the conference would be to have a much clearer view as to where do we stand now, what sort of experience has been gained, etc.
And that makes me think from where we are now, where do we want to get to, and what's it going to take, and will people be ready to take on that challenge? Wim, do you want to answer that?
Yeah, I think there is a kind of common perspective in terms that we want to ensure sustainable healthcare for the future, and I think that quite recently, I think a very important society or council in the Netherlands called the Netherlands Scientific Council for Government and Policy came with a kind of advice what we need to do in order to keep our healthcare sustainable. And I think we have to make choices. And these are not just choices about saying yes or no, but these are choices about what are we going to do and what are we going to do less. And again, I think this is something which actually these kind of decisions will involve the whole life cycle of technologies. So we need to be more early involved as HTAi organizations if new technologies involve. So what are we going to do? Where are we going to prioritize? Where are we going to make decisions on? But subsequently, if these technologies be available for patients, what are we going to do with the clinicians, with the people who regulate it? How are we going to make it available? Is it a kind of interaction between all the stakeholders, or are we still doing our own things? So I think this life cycle approach for me is also very closely linked to the sustainability of our healthcare systems. And we cannot do this with a very one-off decision-making process. So also over there, we need to do this together. And I think I will say a few words on that later on with, for instance, the clinicians who treat the patients and the patients itself. So what kind of HTAi elements actually come to the shared decision-making on one hand, but also, for instance, in the kind of interaction we have for pharmaceuticals, but also more and more for medical devices in terms of regulation. How is this going to balance, and how are we early going to affect on which technologies will come to the market and which ones are going not to the market? So, so this means a really early involvement to actually ensure the best healthcare quality, but also to keep our healthcare quality sustainable over a longer time, over a very long period.
Oh, and so, Hertjan, are there risks associated with this transition? I mean, might it work out that we end up with something unintended?
I think we need to think about that very carefully. I think from the discussion so far, it is clear that making this transition is not a unilateral thing. You cannot, so to speak, as an HTAi agency say, okay, guys, as of tomorrow, we are going to adopt this life cycle approach. We have to involve all, because it's going to affect so many other parties. And so we tend to think perhaps primarily from the side of the producer who is going to produce the different sort of HTAi reports associated with this life cycle approach, but they're at the receiving end. We have to think very carefully, who are they? What are they supposed to do with what has been produced? What are the sort of instruments that they have in order to act upon this, et cetera, et cetera. So I think it's really a huge thing. It's going to take time, and we're going to make some mistakes, I think. So it's always also a matter of trying to make sure that we sort of manage the expectations and make sure that we can deliver. And of course, there is this idea of perhaps it's better to do a small thing, a sort of limited thing very well, than doing a lot of things poorly. So there's a trade-off here, and there is a huge challenge for HTAi agencies, but also for all other parties involved. So we have to really be careful and reflect on, okay, so this is going to have many implications for where do we get our data from? What sort of methods are we going to use, et cetera, et cetera. And we have to make this transition together. I think that is the key thing here, and to be very attentive that all parties who have, it's a matter of collaborating here, that we do this really together, because otherwise, yeah, there may be some risks of, you know, not really being able to deliver what we hope to deliver.
Thank you, and that makes me think that it will be really important that we have representatives from these different parties in Utrecht next year. And so Wim, what do you hope that the conference will achieve? What is it that delegates can expect to get out of it? Is it going to be new ideas or new partnerships or inspiration, or what might come out of it?
Yeah, I always believe that conferences, certainly if they're face-to-face, should actually provide a lot of inspiration for the people who participate. I think that is something which I've missed in all these virtual conferences, how good they are, is that you actually have that kind of interactive discussion after a panel session, or in between panel sessions, or in the evening, about these ideas that will come back. And I think that one of the things which I've seen over the last years, that there are many good initiatives, many thoughts, but sometimes I miss the kind of interaction, especially the last 18 months. And I hope this conference can really provide some cross-fertilization between all these initiatives. Just to give you an example, we talk about, well, if we talk about this lifecycle approach, what is going to feed into this lifecycle approach? What kind of data? So that kind of data, real-world evidence, big data, there are so many initiatives which have links with HTAi and with other, also with other stakeholders, that we have to find a way where we can actually ensure that kind of interaction at the HTAi conference. And I'm hoping that a lot of people who do that kind of work will actually participate. But also, for instance, this kind of interaction between for instance, clinicians and HTAi. I think you have something called Kinata. I think that's a very worthwhile initiative where there is a kind of active involvement to actually ensure more kind of discussion between clinicians and HTAi people about new technologies and how to use it and what's most effective. A last thing, I would be really interested to see what can we do to actually even get more interaction between stakeholders, but also between policy and science. I think we have been struggling also in the Netherlands. So what can we do to actually ensure that scientific developments really feed into, for instance, HTAi? On the other hand, I think we have heard, and I know a little bit because I work at both sides, that people at the science sometimes say, well, we really do not know what your questions are. So we do not know what kind of research we want to do. So can we really facilitate that to a conference? And I think in countries, different methods are being used to actually facilitate this more active involvement between policy and science.
That's a very useful response. And I just looked at the time and I realized we've already used 25 minutes of our 30-minute chat, but I'm still going to keep going because I've got a few questions coming in. So if you don't mind, although we said 30 minutes, we might run to 40 if we take that long. And I'm sure the clever Bryce can do something with the edit later. So Gert-Jan, I understand this year that we're having sub-themes again. Can you tell us about the first sub-theme?
Yeah, the first sub-theme, so it will pick up on the general theme of the life cycle approach, and then focus on two issues, which are priority setting within HTAi. So what are the technologies that should be preferably subjected to a formal assessment? And the second issue will be international collaboration. And the reasoning behind this is that, if anything, when we are going to adopt this life cycle approach in HTAi, it is likely to produce more work, to diversify the activities, to require different sort of expertise, different type of involvement of various stakeholders, but it's likely to sort of produce more work for HTAi agencies. And there is, of course, a huge challenge. Will they be able to meet those challenges? Will there be sufficient resources in order to accommodate this? And in fact, it may make the issue of priority setting more important, so that we more explicitly try to reflect and discuss what are the technologies that seem to really be in sort of need of a formal assessment? Why do we think that is the case? And of course, there sort of coordination and international collaboration may be needed also more urgently, so that we can sort of distribute the tasks among the various agencies. We know this is a huge issue and a huge challenge. And we know that, of course, countries may differ in terms of their context, their economic situation, etc., etc. So there will always be questions that may be fairly country specific, but still, when we look at this development, we may have to set priorities more urgently and collaborate more internationally. And then the question becomes, of course, okay, so do we have the methods to also try to better understand what are the costs of not conducting an assessment of a specific technology, or what are the opportunity costs that are associated with conducting an HTAi, etc., etc. So I'm really looking forward to that plenary, and I think it will raise a number of questions that are very relevant to this life cycle approach in HTAi.
Oh, that sounds incredibly interesting. And going to have some fascinating discussions in Utrecht on that one. And Wim, you've been leading one of the other plenaries. Can you tell us about it?
Yeah, I think it's a little bit following up to one of the earlier remarks I made on interactions between stakeholders which make decisions on access to health technologies, for instance, HTA bodies, regulators, clinicians. What can we do to facilitate more interaction? Although we sometimes still believe that they have a different role, I think they quite often use the same data, look at effectiveness, and sometimes it's not so easy to explain why they come to different decisions. And also for patients, it's sometimes not very easy to understand why they go in different directions. So what can we do to facilitate better interaction between those group of stakeholders? And what's in for patients? What do you think about this more close involvement? And then at the other hand, also, if we think that a kind of interaction is helpful because it would ensure earlier access to better healthcare. How do we then assess the data to do this? And do we have different standards to assess those data? Or do we think it's time to actually align those standards so that we also find a more common perspective, so that for not only the patients, but also for our organization who develop those technologies, there's more clarity on how they have to do their studies and trials, and have also feel more consistency in how their researches are being evaluated.
Yeah, that's great. I'm going to ask myself the Dorothy Dixer, and what's your sub-theme, Anne? And thus I will answer. And so I'll let you know the third sub-theme is public confidence in healthcare decision-making. And while it's linked towards life cycle may not be as immediately apparent, one of the reasons we're including it in this meeting is because public confidence in healthcare decision-making is a real issue that we're all taking away from watching around the world how people respond to healthcare decision-making during the pandemic. And what we can see is that there's people who have different worldviews, and some of those publics are very distrustful of science and government and healthcare decision-making. So what does that mean for health technology assessment? And what does it mean for a community that's often associated confidence with scientific rigor and hasn't had to focus so much on public confidence? So we might look at confidence about whether recommendations are implemented or whether we're funded. So public confidence has an importance to us, but it hasn't been a really driving focus. And one of the questions, I guess, is that when we talk about public confidence, we think about these ideas like credibility and legitimacy and procedural fairness and transparency. And when we talk about those issues in health technology assessment, we tend to look at processes to integrate stakeholder perspectives. And so we're looking at that field and we're thinking, has HTAi been able to resolve that tension between scientific rigor and integrating stakeholder perspectives, and where is it doing it well, and what can we learn from that? And then if we step back and look at this big question of the life cycle approach, we're starting now to see potentially international collaboration. We're potentially seeing a much more diverse stakeholders and new stakeholders that we haven't had to engage before. How are we going to integrate these perspectives? How are we going to manage power imbalances? There's a huge range of questions that come out of that. So I think it's going to be a really fascinating sub-theme, and I can see and I hope we'll attract a lot of good abstracts in this place. We're hoping we'll kick off that plenary with a debate about whether HTAi builds confidence in public confidence in healthcare decision-making, and I think that should be a really interesting session. So I'm just going to check in with Bryce. I've got some more questions here, but I just want to check in with Bryce to see whether I've missed anything in there that's coming through.
Haven't missed anything yet, Anne. You're good to continue.
That's great. Do you mind, co-panelists, if I ask you each one more question?
That's okay.
No.
Great. And then, so Wim, I've never been to Utrecht. What's it like? What can we expect when we all hope to get there in person next year?
Yeah, I think it's a great city. Of course, I'm somewhat biased because I live here for more than 30 years. But I think it's convenient because it's a city in the center of the Netherlands, and very, very close to Schiphol Airport. But the nice thing, it's a city with all the benefits of the city, but it's still cozy and small, and that's something we like as Dutch. But it also has the largest university of the Netherlands. So there's a lot of academic activity everywhere. And I think there is also a quite nice HA activity, which can be linked also to the conference. I think also one thing you will notice if you come in Utrecht, that you see a lot of bikes, which is very common in the Netherlands. But in Utrecht, I think we have the most occupied lane for bikes, and we have the biggest biking garage which can have 20,000 bikes. So I think that is something, if you come to Utrecht, you have to bike. So I hope we can ensure that as many participants can have a bike and just bike around and see the city. And finally, of course, we have a lot of nice restaurants and bars, and some know that I like to go to bars with people from the HTAi community. So there's a kind of open invitation to come, and I will be able to show you the nicest bars in Utrecht.
That sounds wonderful, and I'm very excited to think of us all biking off to conference each day. That would be fantastic. And Gert-Jan, just before we finish, everywhere around the world, HTAi looks and feels a little bit different. Can you just give us some insights into the Dutch HTAi system? You know, what are the big issues and considerations in the Netherlands at the moment?
Yeah, well, I think Wim already mentioned this. Of course, as in many other developed countries, the sustainability of the healthcare system is really an issue. It has been an issue for many years, but with the recent report that Wim mentioned, it seems that we will not be able to continue doing things the way we are doing now. So more strict choices may be necessary, and that is going to be really a challenge. This is nothing new, but the huge challenge is here, of course, how can HTAi contribute to this very challenging sort of development and societal debate, in a way that also that people are, as you said, sort of confident that their concerns are being taken into account. So we are looking, of course, at very expensive new drugs, for instance, for children with spinal motor atrophy. Of course, these are sort of tragedies, no? An apparently healthy child is born, and within a few months, the parents have to acknowledge that there is a congenital progressive muscular disease. The child will probably die before it reached the age of 2. And there is now this new drug that seems to, give them some hope. Are we or are we not willing as a society to cover the cost of these new types of drugs? And how does that relate to the persistent concern about the sustainability of the healthcare system as a whole? I think these are really the sort of key challenges where HTAi has to see whether it can really contribute in a meaningful way. This is the key challenge, I think.
It will be interesting to see whether our conversation is changing as a result of the pandemic, or if it changes as a result of coming together to talk about the life cycle approach. I have one last question to squeeze in before I'll ask you whether you both want to make any concluding comments. But we did have the question, different types of health technologies may have very different life cycles. Do you think there'll be a chance to discuss this issue at the annual meeting? Well, I don't know. Would either of you want to answer? I hope so too. I think you've alluded to some of those different types of health technologies. Wim, would you like to make any last remarks before we wrap up?
No, I hope this has provided some more clarity to the ideas which we have for the next conference. And again, I think this was a kind of starting point. So if there are more questions, I think we're always open to support and to think. And I think we have, through the ISPC, the International Scientific Program Committee, but also to the local organizing committee, we try to ensure that involvement internationally and nationally. And I think there's a lot of openness to actually get these new ideas into the HTAi. So I'm looking forward to it, and I'm looking forward to see you all live next year in Utrecht.
Thanks, Wim. Hertjan, did you want to say anything?
No, I completely agree with Wim, and I think indeed there are stakeholders. When we adopt this life cycle approach, it will be very important to liaise even more closely, I think, with clinicians, for instance, as Wim mentioned, with industry, when we are going to do this early HTAi, et cetera, with policymakers. What sort of instruments do they have in order to act upon the sort of information, the sort of understandings that we can produce by doing HTAi? So it would be wonderful if we could make sure that representatives of all those various stakeholders, including, of course, patient organizations, etc., will attend this meeting, because I think there are very, very interesting and challenging issues to discuss. And I think this is really only the beginning.
Wonderful. Well, I'd echo those comments and thank both our panelists and my co-chairs, who I could ask questions of all day, and appreciate your wisdom on this. Can I also thank the International Scientific Program Committee members, our local organizing committee, and our annual meeting committee, and the HTAi Secretariat, especially today, Bryce Doherty and Amran Thakur, who keeps us on the straight and narrow. So thank you all, and I hope this has been useful. Bye for now.
Thank you, Anne, for moderating.